Hi, we're group 218 and we will be doing a femoral nerve block today for a patient who is having a right total knee. And some contraindications that we've already just looked at in reviewing her chart are absolute contraindications would be that she is refused, or that she has an infection at the groin site that we'll be going into, or that she has any kind of coagulopathies, which her labs don't indicate. So we're going to go ahead and interview her and get ready for our block. So I'm going to my patient room now. Hi, my name's Lucy. I'll be your nurse anesthetist today doing your procedure. And what's your name and what are we doing for you today?
So my name's Amy Wright and we're going to be doing a total right knee.
Okay, and you're agreeing to this procedure? Okay, let's talk about it a little bit. There are some risks and benefits to this procedure and putting the block in. Now, you don't have any kind of infection right in your groin site that I'll be needing to go into block.
No.
Okay, very good. So I will be going into that right groin to be able to put a nerve block in that will block for the procedure. Benefits to this is that you will be able to get on your feet faster. You'll use less opiates afterward, less pain because you'll have the nerve block. You'll be able to exercise and get on your feet faster, so a better recovery. Some of the risks, however, are that we do have to insert a needle in there. We'll use some local anesthetic to be able to numb it when we do that. And we could cause an infection there at the needle site. You could also have some bleeding there. Those things are very unlikely, but it can happen. And we could discover that you are allergic to the local anesthetic. We obviously have medications to be able to counteract that, but that could be a discovery that we won't know until we do the block. Any questions about the procedure?
You explained it really well, thanks.
And you're consenting to the procedure. Okay, so I would get my consent from her, and we would go gather our supplies for it.
So after interviewing and consenting our patient, I went ahead and had her lie down, and then I'm going to gather my supplies. We're going to be doing a combination technique of ultrasound and peripheral nerve stimulation. So I've got my peripheral nerve stimulator here, I've got the ultrasound over here. I've got my block kit. That should have everything I need in it, sterile gloves, and then I'll be injecting the local anesthetic with this three-way stopcock setup. She was a little bit anxious getting ready for the procedure, so I went ahead and gave her 2 of Versed and 50 of fentanyl. And then I hooked her up to blood pressure cuff, gave her some supplemental oxygen, O2 sat probe, and then EKG, just to get a baseline telemetry to make sure that she doesn't have any like 2nd or 3rd degree block, because that could potentially preclude her from getting this femoral block.
Yeah. So at this point, our patient is supine already. We're going to take a look with the ultrasound first and just confirm our landmarks before we get started. So coming over here onto our ultrasound, we'll confirm that we do see the femoral artery. It should be pulsating right there. Medial to that, we'll see the femoral vein. We confirm, pressing down with the ultrasound, that this is compressible. Moving more lateral, we're going to look for our fascia lata. And just below that, we'll see the fascia iliaca. So the femoral artery and those 2 fascia will kind of form a triangle where we'll see our femoral nerve right here. Okay, so next, now that we've already confirmed and marked our landmark for where we're going to put our skin wheel, I'll go ahead and put on sterile gloves, mask, gown, all of that. We'll open up our kit. First, we'll start with ChloraPep or whatever we're using. Here you're going to feel a little bit of cold. We'd scrub that for 2 minutes and start allowing that to dry. While that's drying, I'm going to go ahead and have my assistant pull up my medications. We'll put 40 mLs of local anesthetic, and we'll add 4 milligrams of dexamethasone to that. All right. So assuming 2 minutes has passed, we're going to go ahead and drape our patient. All right, so you're just going to feel a little pressure here. Well, I put a little plastic drape on you. All right, so we have that all confirmed. I'm going to draw up some local anesthetic for that, some lidocaine for that skin wheel. And, all right, you got all that squared away? So we're going to, actually, I'm going to have you drop that probe into this sheath cover. We'll have some sterile gel. We'll put some in there. I'll have you go ahead and drop it in there. Once I grab this, I'll have you slide that cover down. This will keep our probe sterile. All right. Now that we have that squared away, you're gonna feel a little bit of cold here and a little bit of pressure. I'm just taking another look. We're gonna reconfirm that our landmark is still good. All right. So I'm gonna put a little skin wheel in here in the area that we marked. little bit of a sting here, and then it should get numb. You're doing great. All right. So next we're going to use an insulated 22 gauge needle that's 4 centimeters long. We're going to attach the nerve stimulator. I'll have you take those. And the local anesthetic, and we'll just flush the line. While she's flushing that, I'm going to go ahead and grab my ultrasound, and our patient should be numbed up with that skin wheel now. So I'm going to go ahead, reconfirm my landmarks, and I'm going to advance in plane the needle just a little bit till it's into the tissue. I'm going to have you go ahead and turn on that nerve stimulator and set it to 1 milliamp. So once that's on, I'm going to go ahead and, using a Bramage grip, I'm going to advance that needle so we're getting closer to the nerve, and we're watching patient's leg here until we elicit a patellar twitch. Alright, so now we have a twitch at 1, so I'm going to just hold my needle there. I'm going to have you turn that down, and we're going to keep watching until we lose the twitch in the patient's leg. So
7, 6, 0.5, 0.5, 0.4, 0.3.
and there we've lost it. Okay, so we'll go from 0.3 back up to 0.4 and we'll see if we've reestablished that twitch.
0.4.
And we have. So we still have a weak twitch at 0.4. So using again the ultrasound, I'm going to advance the needle a little bit closer to the nerve until I have a strong twitch at that 0.4. Alright, so I've reestablished a strong twitch, so we'll turn it down and see. Turn it down a little bit more. Yep, 0.3, and we've lost it again. Alright, and turn it back up to 0.4, and we have a twitch. Alright, so at this point, I'll have you aspirate. Alright, perfect. We're not getting return. So I'll have you give 1 ml, and we're watching, we're trying to ablate the twitch with that 1 ml of local anesthetic. And it looks like we were successful. Alright, so I'm going to have you give, aspirate again, and give 5 mLs of local anesthetic. I'll be watching the ultrasound. We'll continue this aspirating, giving 5 ml boluses until we've given volume anywhere between 20 and 40 mLs. We'll be using the ultrasound as a guidance, and that should be sufficient to numb up our patient.